Welcome, everyone, and thank you so much for joining us today. My name is Stephanie Paul, and I'm the Executive Director for MyFace. I'm pleased to welcome you to our very first web education program designed for people with craniofacial differences, caregivers, family members, and healthcare providers. I would like to thank the Milbank Foundation for funding this important program and acknowledge their appreciation for the critical need to provide educational programs like this one to people impacted by craniofacial differences. MyFace advocates for a holistic, comprehensive team approach to care through the wide range of programs we fund, including support of the world-renowned MyFace Center for Craniofacial Care at NYU Langone Health in New York City, which serves as the gold standard for craniofacial care. In addition, MyFace provides other important services such as access to individual and family support groups, topic-driven workshops, informational webinars and networking opportunities, travel assistance, and housing for out-of-town families, as well as education and public awareness. MyFace is here to support the craniofacial community and help transform the lives of children and adults living with facial differences. We believe everyone deserves the chance to thrive and live out their dreams. And now to our program. Our presenters today are Dr. Joseph G. McCarthy, the Helen Kimmel Professor Emeritus of Plastic Surgery and Chairman Emeritus of the Hansjörg Wyss Department of Plastic Surgery at NYU Langone Health. Joining him is Patricia Chibbaro, RN, MS, CPNP, Pediatric Nurse Practitioner at the MyFace Center for Craniofacial Care at NYU Langone Health in New York. After the presentation, we will open the program for questions from participants. We encourage everyone to complete the evaluation after the program because your feedback is instrumental in helping us plan for future educational offerings, including webinars like this and other programs. It is now my pleasure to turn the presentation over to Dr. McCarthy and Pat.
Hi, everyone. This is Pat Chibbaro. I am really excited to be joining you. I just can't even begin to tell you what an honor it's been to have been the pediatric nurse practitioner on this team for over 30 years, and for 25 of those years to have Dr. McCarthy, who is one of the pioneers of craniofacial surgery, to be my boss, my work husband. And so we're really, really excited to talk with you tonight about the importance of finding the right team for your child or for yourself, because we really believe that this is the beginning of your journey, and finding the right team is incredibly, incredibly important. So how did this concept begin? And you really have to look back to World War I and World War II, specifically when you had injuries that required the care of multiple different people. And really that was sort of the beginning of team care. You had patients, you had soldiers who ended up having issues with burns because of explosions and just all of the things that you can imagine, and that a plastic surgeon alone could not take care of that patient. And so that was really sort of the beginning of where team care began. And then you can take a look at NYU, where Dr. John Converse started a program here in craniofacial surgery, which was really one of the first ones to actually happen in this country. But in terms of the first Cleft lip and palate team, that was one that you can look at based in Lancaster, Pennsylvania, and that is where the first Cleft team actually began. So I wanted just to talk about the idea of, why does my child need to be cared for by a team? A lot of patients, when I start talking with them, want to know, when will the surgery be? And I think it becomes very clear, very apparent, that it's not just about having a surgery, that cleft and craniofacial conditions are complex and they require the services of multiple clinicians. And also what's really important is that there may be other needs, other challenges that a child with a cleft lip palate or craniofacial condition has, besides the craniofacial condition itself, besides the cleft lip and palate, besides the craniosynostosis, that we need to look at and we need to take care of before and after surgery. I wanted to make sure that you contributed to that in terms of the evolution of the concept. In case I left anything out, you're the history buff, you know it better than I do. I hope that I covered it a little bit, but if there's anything you wanted to add.
No, I think it's fine.
The latest thing that I was saying was that there are things other than the surgery itself, the procedures themselves, the hearing, breathing, nutrition, those kinds of issues, the psychosocial issues that we need to deal with. So, yeah, I think we can jump to this slide. So why don't you take this one?
Sure. This is a continuation of the topic of why does my child need to be cared for by a team. And of course, the management of the child with a cleft craniofacial condition requires treatment through childhood and adolescence. And it's for one reason. The face continues to grow until 18 years of age. The bone and the teeth are constantly changing while a child is growing. So we really don't have a fully formed face until approximately 18 years of age. The other thing to stress is that the team approach to care is very efficient. Team care can accomplish in one visit what could take weeks or many visits to accomplish. I'd always say to the families, we're going to spend Monday morning together, and it's going to seem hectic, but I can tell you that you'll accomplish in one morning what would take many visits and weeks to accomplish, because the team is together and talking among themselves directly.
So I think one thing that's important and that parents and patients really appreciate is when they see the team members literally sitting together or talking together. I think that really instills a lot of confidence that there's a great communication that's going on between the surgeon, the orthodontist, the nurse practitioner, the social worker, the speech pathologist. I think that is a very important strength of seeing patients in a team setting.
Absolutely. And the parents and the whole family are an important part of the team concept. The families, I think, who did best when I was in practice are the ones who really joined the team. And I think siblings are also a very important part of the team. In other words, this is holistic or total care. The last bullet sums it all up because it is a journey. And it's a journey of meeting with doctors, being treated, but a very positive experience. Some years along the journey are quieter than others. Others are busy with operations, braces, speech therapy. But most of all, if everyone participates in the team, it's a positive experience.
I could not agree with you more, and I want to stress exactly what you said in terms of the family involvement. You know, it's difficult, obviously, during COVID to be able to have a lot of family participation, but we want to know what's going on with your family, with the siblings. We encourage grandparents to be involved, and we want to know everything we can about your family so that we can understand your needs, the challenges that you're facing in order to have the surgeries or treatments that we're recommending so that we can help you and really be able to give you that comprehensive care. But you're right, it is a journey. It's not just a surgery. I think that's a really important point.
I remember one day I was on the street in New York and a woman said to me, "Oh, Dr. McCarthy, you don't know who I am?" And I said, "Yes, I think you're so-and-so's grandmother."
Wow.
And it was a family that truly embraced the team concept.
Absolutely. So I'm going to go on to the next slide. I want to just let anyone who's listening to this know that we have an incredible organization that is one that exists both for professionals and for families. This is the American Cleft Palate Craniofacial Association. It is a professional organization, and we are dedicated to supporting the comprehensive care of patients and families. The members of this organization are from all specialties, and they're from all over the globe. And the major goal, one of the major goals of this organization, and certainly it's a goal that is one that is in alignment with the goal of MyFace, and MyFace works very closely with the American Cleft Palate Association, is to provide education and resources both to us as clinicians and to patients and families. And I want to point out a very important document that I think all families should download, should have in their arsenal of supportive documentation for why the care that their children need is medically necessary by a team. And that document is the parameters for evaluation and treatment of patients with cleft lip and palate or other craniofacial differences. This document was first published in 1993 and has been updated several times. The last time it was updated was in 2018. And below you see the website for the American Cleft Palate Craniofacial Organization, and it has a lot of resources both for us as clinicians but also for you as patients and families. I wanted to show you, this is the document that I'm talking about, and there's a lot in this document, but there are two things that I wanted to point out that Dr. McCarthy and I are going to be talking about more throughout this presentation. And the two principles are, first, that management of patients with craniofacial differences is best provided by an interdisciplinary team of specialists, and that optimal care for patients with craniofacial differences is provided by teams that see sufficient number of patients each year to maintain clinical expertise in diagnosis and treatment. And I think that that is a critically important point that we'll talk about more in the presentation, but we want you to know that the American Cleft Palate Craniofacial Association has a listing of certified teams that go through an application process to really show the organization that they are a comprehensive team, that then the American Cleft Palate Association can feel comfortable when you call to ask about a team in your area, that they can refer a specific team to you. So I wanted you to know that. I think that's a really helpful document. And I think one of the things that parents have told me that they used it for was, if you're having a problem with getting coverage for speech pathology or orthodontics or whatever it is, ear, nose, and throat treatment, whatever it is, this document is one that they have actually submitted to the insurance company to show that this professional organization has said that this is a key principle of care. So I think that's really, really important. So I think, Joe, I'm going to turn it back over to you just so we can break down a little bit what these teams are and who should be on a cleft lip or craniofacial team.
Well, a cleft lip palate team is not unlike a baseball team. There are pitchers, there are first basemen, there are third basemen, center fielders. And originally for the cleft lip and palate team, the mandatory requirement was for a plastic surgeon, an orthodontist, and a speech pathologist. But over the years, we learned that the team needed to be expanded, mainly because of the journey we were talking about. Often extra dental work is required. Often, especially now when we know much more about genetics, the geneticist becomes very important. Now, after the first three specialists, the others are listed only alphabetically. They are not listed in what we think is more important than the other. They are listed alphabetically. And as you go down the list, you see the otolaryngologist, very important in terms of hearing or airway problems. Pediatric dentistry, as you know, is very different than adult dentistry. It requires a dentist who knows how to work with children, how to calm them down, win their confidence. And moreover, the dental problems are very unique in cleft lip and palate. Pediatrician, psychologist. Psychologist is very important because the services of the psychologist are not only for the patient, but also for parents and siblings. Orthodontist, RN, nurse practitioner. I can tell you at NYU, Patricia Chibbaro is the key person to keep the team moving. Social worker, team coordinator. All of these, just as in a baseball team, are critical players. Pat, why don't you talk a bit about the players on the craniofacial team?
Sure. So the craniofacial team, as you can see, has pretty much every single person that is on the Cleft, Lip, and Palate team. But what I have highlighted in red are two of the members that must be present in order for a craniofacial team to really designate themselves as a comprehensive craniofacial team. So in terms of a neurosurgeon, that is a person that must be available and experienced in caring with the plastic surgeon, with the craniofacial surgeon, for patients who are born with craniosynostosis syndromes or with an isolated craniosynostosis who may only require one surgery. But we on our craniofacial team, we cannot care for complex craniosynostosis patients without having that partner on the team, and we work extremely well with them, and they come to our team meeting, and I think it's really, really important that the family sees the craniofacial surgeon and the neurosurgeon together so that they can really feel comfortable that they are getting the right care.
Pat, may I just interrupt for a second? You said together.
Absolutely, Joe.
And it makes a big difference when the plastic surgeon and the neurosurgeon are together because they examine the patient together, they talk together, they work out a treatment plan together, and then the craniofacial surgeon and the neurosurgeon can sit down with the patient and family right there directly and say what they recommend or what they want to do. And there's no delay. So Pat had used the word together. And I can't emphasize enough how important it is for the two specialties to see the patient together.
I agree. I think the other thing that is important as a balance is it can be very overwhelming, and any families who are listening right now, if you remember your first experience with a neurosurgeon and a craniofacial surgeon, that can be very overwhelming. But to be able to have on that same day the social worker, the psychologist, the nurse practitioner to be there to sit with you and make sure that you are understanding what's going on, to help confirm or to help clarify what they've heard. They're very overwhelmed often. It's the beginning of the journey, and that's one of the reasons we want to all be here together to provide as much support to you as possible. And then the other person, the ophthalmologist, again, with the kids who have craniosynostosis syndromes, the ophthalmologist is very important because these are children who could have increased intracranial pressure, and it's something that an ophthalmologist, especially one who has experience looking in and behind the eyes of our patients, can help us with a diagnosis and with early treatment if needed. So they're a very important part of our team. So I wanted to highlight those two as well. So I think we're going to go on to the next slide. So I think that we decided I was going to kick this one off. So in terms of how to find the team, the referrals can come from your pediatrician, from an OBGYN, from a geneticist. A lot of our families come through personal referrals from friends, family members, coworkers. Again, you can look to the American Cleft Palate Craniofacial Association, especially through their team membership directory. Absolutely, you can visit the MyFace website. They are very, very helpful. And then the final one that I think is really important, and in preparing this, Joe and I were talking about this at length, is that internet groups, and everyone of now, of course, is on the internet. And I know, Joe, when I was first working with you, there was no internet. And so families had no ability to find out about these craniofacial conditions until they came to see us, or maybe they found a book in a library, but it was very rare. And now families are coming in with a lot of information. I do think it's important that when you're online that you understand that there are many different internet groups and that these people who are posting have experiences that are very varied. They may have a child who has maybe the same diagnosis as your child, but they may have a very different experience. So I think it's very important to really sort of listen, but with some filtering. And also, there are many patients who have come to us who are on some of these family groups, and many of them have said there were 12 people who recommended one of your surgeons, and that's why we're here. Now, that's great, but that's the beginning. And so we just want to make sure that you are careful when you're looking at internet groups. Joe, I don't know if you wanted to add to that a little bit.
Yes, I agree completely. And you have to watch out for self-appointed experts. And I think as social media has grown more and more, this has become a bigger problem.
Absolutely. Okay, let's go to the next slide, Joe, in terms of, and we really want this to be one of your takeaways, are the questions to ask before you meet a team and then those that you can ask while during the meeting. So, Joe, let me have you kick this one off.
All right. This is a list that you should make before you go to the meeting. In other words, get a pad of paper, write down these questions so that if they're not answered during the meeting, look down at your list and say, oh, I forgot this question. It hasn't been answered. So these are questions that you should make a list of before the meeting. The first one is, do you have a separate cleft and craniofacial teams? Well, Pat and I are used to the NYU experience, and since the 1970s, we had a separate cleft, lip, and palate team and a separate craniofacial team. But that is not the standard or the practice around the country for some very good centers. But we feel it's the ideal because craniofacial problems can actually be more complex. Another question is, how long has your team been together? Well, it's simple. The longer the team has been together, the better the performance of the team. Again, using the sports analogy, we see that in baseball and football. The teams that have been working together, playing together, tend to perform better. Another question is, how often do your teams meet? And again, the answer is the more, the better. And at NYU, the individual cleft teams and craniofacial teams meet 3 to 4 times a month. Who are the members of your team? Another very important question. But I think in our previous slide, we showed you who we think should be on these teams. And you should expect to have a list of who are the doctors from the different specialties on that team. And Pat, I think most centers have handouts that give that, don't they?
Right. What we try to do is, and we keep updating this, is to give you a list, at least if not in advance, but when you come in, with photographs of every single person that you're going to see and with their contact information so that you know not only who you spoke to, but if you have a question for that person, you can reach out. So, no, very important.
I don't think you can be a member of a team unless you know who's on the team.
Absolutely. Very important. So just wanted to get to another list of questions that you want to ask. For example, who will be present at the meeting? You want to know which of those team members will actually be there. And in some cases, you may have to make a separate appointment for one particular member who may either just have conflicting office hours or who may not be able to be there. You may want to reschedule to make sure that all the people that you want to have are going to be there. You also want to know, is everybody in the same physical space? Do I have to go from one place to another? I think that's very important, and we're very grateful that everyone on our team, we're all housed in the same place. Another important question is, does your team participate in our insurance? Because especially if you're coming from out of state, you need to know what you're dealing with in terms of insurance. So that's certainly an important thing for you to look into, and every insurance policy is different, as everybody knows. And I think the last question that is certainly important is to ask whether or not your team is listed in the ACPA membership directory, but that would be something that I'd hope that you would know, because you will have gone to that site and you will have checked that, because I think that is very, very important. If you are not going to a team, if you're going to a team that is not in that directory, I think that's a red flag. I think that that is something that you have to seriously consider.
On the next slide, you see probably is the number one question that patients and families want to ask. What are the treatments that might be involved over the years in my care? And how many surgeries or operations might we need? And I think the patient and family really should be presented with a rough idea of the typical treatment course for a child, a patient with that condition. I always felt that at the first meeting, I would always try to give a rough idea of what I think is probably in store for the patient in the years ahead. You have to understand that as the years go on, there may be differences here and there, but I think at the first visit is important to get an idea as to what is in store for the patient. The next question is another very important question. How many patients with our child's condition do you care for every year? And every center keeps statistics, and they should be able to tell you how many patients with this condition or how many patients with Cruzon syndrome are they following or have they treated. Centers have these statistics, and I think it's very important for patients to receive them. The other important point I'd like to make is that the first operation sets the course. Often in these conditions, if the first operation is done well, everything thereafter falls in place. I think a cleft lip is a good example. If the primary repair of the cleft lip is done well, the cleft palate follows well, the orthodontics follow well. And I think that's why it's important to go to a center where there is a big experience. And then patients should ask, as Pat mentioned earlier, to see or to look at pre- and post-operative photos of other children with the same condition. This is a fair question, and centers have these photos, and centers also have patient permission to show the photos. And you should also ask to see the photos of several patients who have been treated at that center.
In terms of seeing photos, as Dr. McCarthy said, we get permission from families. And if you are with a team that says they can't show you any photos, that's another red flag. To be with a team that isn't able to show you their work, I have a problem with that, and that's something that would be a flag for me. So in terms of some additional questions to ask during the meeting is, in addition to seeing photographs of other children, may we speak to other parents whose child has the same condition? That, I think, is incredibly important. We can tell you as a team how great we are and all the wonderful things that we do, and you've got to come to us, but you need to hear that from another family. You need to hear the pros and cons and the things that they feel are important for you to know, because that, I think, is an incredibly important part of your questioning. And this one, Dr. McCarthy and I were talking about before, and I think it's important, is because a lot of parents know now that people on teams have published things. What kind of work have you done that you've actually published, and could you give us some of those references? Dr. McCarthy, could you elaborate just a little bit on that one?
Yes, I think that's a fair question, and I was asked it many times. And I think publications reflect that the team is on the cutting edge of treatment. They are up on the latest treatment advances. And also, it reflects that they are taking care of a large number of patients, because you cannot write scientific articles unless you have a large number of patients. And in general, teams that are writing papers are also participating in very important scientific meetings where they learn about the latest advances. So I think that's a fair question.
And then the last bullet on this slide is, does your team have a support group? I think that that is extremely important in terms of looking at getting comprehensive care and support. And of course, we at NYU are incredibly blessed to have MyFace, and I think that the resources, the workshops, just the incredible number of resources they have really is the key to you and your child getting comprehensive support. And I highly recommend that you ask that question. And I wanted to just make sure that any of you who are not fully familiar with MyFace's site and the resources, a lot of what Dr. McCarthy and I talked about in this webinar is contained on a couple of the pages. This one is about craniofacial care teams and what is a craniofacial center, a lot of the things that we touched on in this webinar. And we really think it's important that you have a resource to go back to, and I absolutely recommend this one for you to take a good look at, and it will help maybe even add to some of the questions that you'll want to ask when you're looking for a team. So I highly recommend you looking at that. And so I think at this point, I want to turn it back to Stephanie because Dr. McCarthy and I could spend lots more time talking with you, but we'd love to answer some of your questions. So Stephanie, I'm going to let you take over.
Thank you so much, Pat. Thank you, Dr. McCarthy and Pat, for this incredible presentation. We love the rapport that you both have, and you just gave us wonderful information. So to the audience, it is time for the question and answer. And before the operator gives instructions to submit your questions, I would like to remind all of you that we do have many people joining us on the webinar today. So for the benefit of everyone, please try to keep your questions general in nature, and Dr. McCarthy and Pat will provide an answer that is general in nature. Let's get started with the questions. I'd like to start by asking this question of Dr. McCarthy. How often should we expect to meet with the team, and when we do, will we see all specialists every time?
Well, I think you have to think first of the initial visit, or what we call the consultation. And at the initial or first visit, that's when you meet with the whole team. Thereafter, it depends on what is the condition that the patient has. Sometimes the condition is such that you meet often, and sometimes you meet with only 2 or 3 members of the team or 1 member of the team. And again, Stephanie, it depends on the condition that the team is dealing with.
So just to give you an example of some of the options, so if a child, for example, comes in to see us, to see the team with a condition many of you may know about, which is craniofacial microsomia. So that's a craniofacial condition that could really use the help of many specialists. And so we'll see that patient, and then the team will decide, well, before we can do something else, we need for you to see one other specialist, or we need for you to get a CT scan. And then once that's done, we can then decide who needs to see them next. Sometimes it would be, let's get that scan, and then Dr. McCarthy will review it with the orthodontist, and then we'll call you back to see Dr. McCarthy and the orthodontist to then decide what treatment plan and to actually offer a surgery. And then from there, we would obtain a surgery date, and then we would meet with you before. So that's just one scenario. You may then have a consult, as Dr. McCarthy said, where you meet everyone, and then after that, we may not be recommending surgery right away. We may just be telling you, okay, everything is good, come back in a year. So it's very, very individual. But I think the most important thing is that you as a family know at all times who is that point person on the team that if you're not sure what the next step is, you know you can go to that person. And I'm sort of considered the air traffic controller of the teams where all the families know, and many of them have said, Pat, I didn't know who to call, but so I called you because I knew you would help me. And you need that kind of person. You need to look for that when you identify with a team.
Okay, thank you, Pat. So I'm going to ask you another question, Pat. When should I start looking for the craniofacial team? If I find out from the sonogram, should I contact a care team then? Is that too soon?
No, in fact, we really enjoy and are really excited when families are able to contact us prenatally. And I can tell you that the great majority of conditions we don't see on a prenatal sonogram, but the one that we see most often is cleft lip and palate. And as soon as a family knows, we hope that they will get a referral to a cleft lip and palate team and that they'll come to us for a prenatal consult. And what we do in that consult is we meet with, the surgeon meets with the family, then I do in terms of how to prepare for the delivery. We have a nutritionist on our team that talks about feeding. We have a social worker who meets with them to help support them and give them resources. And our orthodontic team meets with them to explain to them some of the treatment that we can do even before the first surgery. And the family is so grateful for that because it helps them prepare. And I think it helps make them feel that there's a light at the end of the tunnel and that they have some guidance. And so, no, if you have been told that there is some kind of craniofacial condition, right away, reach out, get a referral to a cleft or craniofacial team. Absolutely. Don't wait.
Wonderful. Okay, here's a question for Dr. McCarthy. You mentioned that families should ask how many patients they see per year with our child's condition. What is a good number?
Well, it varies according to the condition. Some conditions, for example, like Treacher-Collins syndrome, are rare, so the numbers aren't high. Some conditions are more common, like cleft lip and palate. And without giving a specific number, for cleft lip and palate, a team should be doing a lot of cleft lip repairs in the course of a year. So again, it depends on the condition. Those that are rare, the numbers of patients being treated are small. But the more common conditions, like cleft lip and palate and craniofacial microsomia, you should have larger numbers.
Great. Thank you, Dr. McCarthy. I have another question for Pat. If I'm already working with a team but would like to make a change, what's the process of meeting with another team?
So do you mean in order to get a second opinion? If you know, for example, that you are either relocating or you want another opinion before you go ahead with treatment with this team, or if you're not really happy with this team, then certainly we all recommend that you get another opinion. And again, it depends on where you live, what your insurance is. You want to check that to make sure that the team that you want to go to see is covered. But you want to check that they're in that membership directory for sure through the American Cleft Palate Craniofacial Association. And I know that MyFace, I think you'll point that out, has a link to the American Cleft Palate Craniofacial Association site. But one of the things that you'll want to do, if you're in the middle of treatment with a team and surgeries have been done, CAT scans, for example, have been done, you need to request those records so that you can share those records with another team. And I think it's very important that families not be afraid to seek a second opinion, because if you're with a team that has a problem with you getting another opinion, then that to me is another red flag, because we are constantly referring families for other opinions, because this is very overwhelming. You may hear that your child needs a cranial reconstruction and you want to know, okay, is that really the right thing to do? So absolutely. But for sure, you can feel confident that it is okay to go ahead and do that, and you should not be concerned about that at all. But look to the American Cleft Palate Association for help in other referrals to other teams.
I'd like to follow up on that. And I was always very comfortable when patients wanted a second opinion. And often, as you know, I'd encourage it. And I think patients benefit from a second opinion. Certainly, if they get the same opinion twice, it's a great comfort to the family to know that they're being given a consistent message. But don't be afraid of hurting anyone's feeling by asking for a second opinion. It's an integral part of medicine today. Wouldn't you agree, Pat?
100%. Very, very important. And in fact, it really is something that is pretty much the standard of care right now, or the standard of practice, is to make sure that you get another opinion and feel confident with your decision.
Thank you. That is really terrific advice. We appreciate that. A question for Dr. McCarthy. Can you highlight the role of a pediatric dentist as part of the craniofacial team for children that need such care?
Oh, absolutely. Critical role. First of all, pediatric dentistry is different from adult dentistry. I'd mentioned earlier, it requires a special personality, I think, to be a pediatric dentist, because you have to win confidence of a young patient. If you don't, an outpatient visit to a dentist by a young patient can be disastrous. So you require unique skills as a pediatric dentist. The dental problems are very different from those of an adult. And finally, in craniofacial conditions, they're very challenging dental problems. So the role of the pediatric dentist is major.
Can I just add one thing? I've spoken to a lot of families about this. I'm not sure that it's widely known, but pediatric dentistry really should start, kids should start going to a dentist, not just kids with cleft and craniofacial conditions, but all children, as soon as you see a couple of teeth in there and they're at least a year old. And because the earlier you get kids in and get them desensitized, the better compliance you're going to have with them throughout their life into adulthood. And I think especially for our patients with cleft lip and craniofacial conditions, who we know have a higher chance of needing orthodontic treatment through their childhood and adolescence, and the earlier you can get them desensitized, it's just a less traumatic experience when they have to be treated by our team. So we 100% support early pediatric dental care. So Really, really important.
And Pat, the
Okay.
desensitized patient makes our job easier too, doesn't it? Because I think they deal with all the specialists in a much more positive way. So hats off to the pediatric dentist.
Absolutely.
Thank you. Okay, so here is a really important question for Pat. Given the current COVID environment, should I ask if and how the team delivers telemedicine, and what specific methods of treatment must be done in person?
So I have to tell you how much I love the ability for us to do virtual visits or telemedicine visits. But before that, I do want to assure families that we are doing, and all medical centers are doing absolutely everything we can to assure that when you come with your child for an appointment or for surgery, that we are adhering to every single guideline and then some. But I can tell you that there are many instances when a virtual visit is absolutely perfect. For example, as a new patient, you really need to come in for an in-person consult. I think that that's incredibly important, to be in person for the exam, just for the whole interaction. For follow-up appointments, for preoperative visits, we can do virtual visits. And what I like about virtual visits is because we're now limiting only one parent to be able to come into the office for a visit. But when I do a virtual pre-op visit, I can have both parents sitting there. The grandparents can be there if they want. The siblings are running back and forth. Everybody's involved. So if you're working with a team that your child is about to have surgery, ask if they can do a telemedicine visit. It's incredibly helpful. And then post-operatively, a lot of families will get on with their child and they will literally put them up to the screen and they'll say, is this swelling normal? And how do you think this looks? And I can save them a visit. And we will let you know when we need you to bring your child in, but it's extremely, extremely helpful, especially during COVID. I would highly recommend using that way of visiting with your team.
Great, thank you. That's really important. I'm going to ask a question of Dr. McCarthy. This is a little specific, but I think it is an important one to ask and would love to hear what you have to say. My daughter has Treacher Collins, and we want a team. We don't think she's ready for surgery yet, but should we find a team now? She's almost 2. Do we physically meet with different teams?
Well, the first answer I'll give is yes, you need to see a team at age 2. As soon as possible, you should go and visit a team. And in Treacher Collins, little ones can often have airway problems. So it's very important that you go see a team, get registered, and see what the team recommends. So it's an emphatic yes. Go find a team and bring the little one to the team.
Terrific. And check out ACPA, the list there, to see if there's somebody nearby you that can help.
Or the MyFace website.
Absolutely. The other thing, Stephanie, is when for kids with Treacher Collins syndrome, as Dr. McCarthy said, some of these conditions, and this is one of them, is they're quite rare. And by coming in to see us, we can then also help to network you with other families whose kids have the same condition. And I've done this so many times in these 32 years I've been doing this, and this is where families feel that they are not alone. When they meet another family face-to-face with a child with the same condition, they feel that there's light at the end of the tunnel for them. Very important.
And Pat, I think Treacher Collins is a condition where it's very important you go to a team where there's a significant experience in taking care of Treacher Collins patients.
Absolutely.
Terrific. Thank you. Question for Pat. How important are the psychosocial aspects of the team, the nutritionist, speech therapist, psychologist, and will my child be seen by each of these specialists even after surgery?
Right. So again, in terms of who needs to see your child, it's going to depend on what your child's condition is and what surgeries or what treatments they need. So for example, a child who has a cleft lip and palate, when they're first seen, they will be seen by everyone on the team, including the speech pathologist, the dietitian, etc. After their first surgery, for the postoperative visit, they will be seen by the surgeon and by myself, just for wound care, suture line inspection, suture removal if needed, that type of thing. And then from there, we will see, okay, what is the next step? Because for a child, for example, with a cleft lip and palate, The palate repair is generally done when they're about 9 to 12 months of age, and it's after that then speech develops, and the next step is going to be for them to see the speech pathologist. So some of the specialists will come in and out depending on where your child is with their treatment. But I can tell you that the psychosocial team is always available pre, during, post, anything to be a resource, and some families need support more than others. And we make no judgment about who we think needs help and who doesn't. We are here for everyone to provide concrete services, support in the community for you and your family. If you're struggling, we watch moms especially very closely for postpartum depression, which we know can be higher in children with cleft and craniofacial conditions, so they are a constant. But each child will be different in terms of who they need to see before and after surgery.
Pat, this is the journey we were talking about earlier, isn't
Yes.
it? And the journey goes on for years.
Right.
Absolutely. So I'll let probably both of you answer this one last question. In working with a team, what kind of communications should we expect back and forth with our pediatrician, and will my pediatrician get recommendations from the team?
So I could
Pat,
answer that one.
Go ahead, Pat. Yeah.
Okay, so many of our referrals are from the pediatrician, and in some cases, after we see the patient, I might actually immediately get on the phone with the pediatrician. If there's an urgent concern from the pediatrician, I will get right on the phone with them and let them know right away what we recommended. We also send a letter to the referring practitioner and to anyone who the parent wants us to send it to, and so we will do that. We also, at least at NYU, we also, after the consultation, we actually put a letter together that each of the specialists puts their part into the letter, and then we email that and hard copy email that to the parents as well. So not only does the pediatrician have the recommendations, but the parents themselves have the recommendation, and they know what we're recommending, when the kids have to come back, and also they have the name and contact information for our patient coordinator and for me and everybody else on the team if they want to speak to us directly.
And I think, Pat, the family should keep a log and a file, and over the years maintain the log and also maintain the files in chronologic order. And
that's really important.
You can't have enough information, and it makes the whole situation so much clearer in your mind.
Agreed.
Well, thank you, Dr. McCarthy and Pat. I cannot thank you enough, and I will say one thing that's really heartwarming as we've gone through putting this program together is how many of your patients over the years have written and just been tremendously grateful for everything that you have done to help make their lives better. So thank you so much for that.
And Stephanie, I'd like to say hello to all of them. I see their names up here.
I know. Me
seeing
too.
their names brings back wonderful, warm memories. So, hello, everyone.
Hello, everyone, and it's just been an honor for us to be a part of your lives for all these years. I am so, so grateful, very honored.
Absolutely.
We thank you both. You are doing amazing things. And I would also like to extend my thanks to everyone who's participated in today's web education program. I am sorry that we were unable to get to all of the questions, but if you have additional questions, you can send them to info@myface.org. Because facial differences can impact the body and the spirit so significantly, MyFace provides other important services such as access to patient and family support groups, everything virtual now, topic-driven workshops, and online programs that serve to educate as well as entertain. These various programs offer guidance, resources, and a supportive environment for all who attend. MyFace also hosts unique networking opportunities, such as its annual holiday party, which will be virtual this year, the MyFace Stars talent show, and all of these empower the spirit. They build strength and community and let families and patients know that they are not alone. For more information about the programs and services we offer, please visit us at myface.org. I also want to emphasize to everyone who joined us this evening that we really do appreciate your feedback and comments and want to make sure that you complete the program evaluation form. We hope you enjoyed this program. Look out for an email to register for our next programs in the Transforming Lives webinar series, one about prenatal counseling and other topics such as navigating the insurance landscape and the importance of psychosocial care. Thank you so much for your time and joining us this evening, and we hope you have a wonderful night. Thank you.